Alcohol, particularly when consumed in excess, is one of the most overlooked but profoundly damaging substances for individuals with high blood pressure. While moderate drinking is often portrayed as socially acceptable or even beneficial in some studies, heavy or habitual consumption creates a cascade of harmful effects that directly elevate both systolic and diastolic blood pressure and accelerate long-term cardiovascular damage. For people already struggling with hypertension, alcohol is far from a harmless indulgence. It is a potent, cumulative threat to heart, arteries, and kidneys. The most immediate danger lies in alcohol's effect on the cardiovascular system. Drinking heavily can cause acute spikes in blood pressure by activating the sympathetic nervous system, increasing heart rate, and promoting vasoconstriction, the narrowing of blood vessels. This effect raises both systolic and diastolic pressure, forcing the heart to pump harder and placing immense strain on arterial walls. Even a single binge drinking episode can cause significant, temporary hypertension, which may not fully normalize for days afterward, particularly in individuals with pre-existing high blood pressure. Repeated episodes create cumulative stress that accelerates vascular damage over time. Alcohol also has indirect but highly consequential effects. Heavy drinking contributes to weight gain, particularly abdominal obesity, which is closely linked to elevated blood pressure. Fat accumulation around the abdomen promotes insulin resistance, systemic inflammation, and heightened sympathetic nervous system activity, all of which further exacerbate hypertension. Additionally, alcohol can disrupt sleep patterns, impair kidney function, and alter electrolyte balance, all of which contribute to chronic blood pressure elevation and vascular stress. The liver plays a critical role in metabolizing alcohol, and chronic heavy consumption can lead to fatty liver disease and impaired liver function. This is significant because the liver regulates cholesterol, hormone metabolism, and detoxification. Impaired liver function contributes indirectly to hypertension by promoting dyslipidemia, systemic inflammation, and fluid retention, creating a multi-pronged assault on cardiovascular health. Heavy alcohol use also interacts dangerously with other dietary factors. People who drink excessively often pair alcohol with high-sodium foods, pizza, processed meats, fried snacks, or sugary beverages, compounding the risk for acute and chronic blood pressure spikes. Even moderate drinking combined with poor dietary habits can significantly accelerate vascular damage, endothelial dysfunction, and arterial stiffening. In many cases, the combination of alcohol and high-sodium foods acts synergistically, creating blood pressure elevations that are far more dangerous than either factor alone. Alcohol's effect on long-term vascular health is particularly insidious. Chronic heavy drinking promotes arterial stiffness, left ventricular hypertrophy, and heart remodeling, making the cardiovascular system less resilient to blood pressure fluctuations. Hypertension becomes harder to control, medications may be less effective, and the risk of serious complications, stroke, heart attack, arrhythmias, and heart failure, rises dramatically. The kidney is also affected, as alcohol impairs renal function and promotes fluid and electrolyte imbalance, further exacerbating hypertension and increasing the risk of chronic kidney disease. Even social or occasional binge drinking carries hidden risks for hypertensive individuals. A weekend of excessive drinking can undo the benefits of careful blood pressure management achieved during the week, creating sudden spikes that stress the heart and arteries. The cumulative effect of repeated heavy drinking sessions, even if intermittent, gradually erodes cardiovascular resilience, leaving the individual more vulnerable to both acute crises and long-term damage. Finally, the perception that alcohol is harmless or even beneficial can be misleading. While small amounts of certain alcoholic beverages may have modest effects on HDL cholesterol, these potential benefits are outweighed by the significant risks associated with elevated blood pressure, arterial stiffening, and metabolic disturbances caused by excessive intake. For hypertensive individuals, the long-term harm of heavy drinking far surpasses any theoretical short-term advantage. In conclusion, excessive alcohol consumption is far more than a lifestyle choice. It is a major, multifaceted risk factor for high blood pressure and cardiovascular damage. Its direct effects on blood pressure, combined with indirect contributions to weight gain, metabolic stress, arterial stiffening, and kidney dysfunction, make it a silent but relentless threat. Habitual heavy drinking accelerates hypertension, undermines vascular and heart health, and significantly increases the risk of stroke, heart attack, and chronic kidney disease. For individuals managing high blood pressure, alcohol in excess is not a minor indulgence. It is a dangerous substance that requires strict limitation or complete avoidance to protect both immediate and long-term cardiovascular health.